So first, I just wanted to point out that even among traditional risk factors, there's disparities by sex, that both diabetes and smoking confer a greater relative risk in women than in men, and even blood pressure. So women start out with a lower blood pressure on average earlier in life, but they're on a steeper trajectory of blood pressure rise their whole lifespan, such that after the age of 60, women's blood pressure on average is higher than men's, and hypertension is more common in older women, and blood pressure is less well controlled in older women as well compared to men. Additionally, there are unique risk factors that women experience throughout their lifespan that men do not, related to pregnancy and hormone and menopause. So there's risks related to the onset of menarche, both early menarche and late menarche. This is the onset of menses. Both early and late menarche is associated with future cardiovascular risk. Polycystic ovary syndrome, particularly the hyperandrogen form, is associated with cardiovascular risk. Infertility and its treatment, miscarriages are associated with cardiovascular risk. I reviewed the adverse pregnancy outcomes. And also early menopause is associated with future cardiovascular risk. So really, this is just a plea for the importance of taking a comprehensive reproductive history to identify women who might benefit from more intensive prevention. I was pleased to be one of the co-authors in the 2019 ACCHA Primary Prevention Guidelines. And in these guidelines, we acknowledge that these women-specific factors of early menopause and adverse pregnancy outcomes like preeclampsia are risk-enhancing factors, where a woman who might be otherwise at borderline or intermediate risk, this would place them into a higher risk category that would favor more intensive preventive therapies such as statins. I just wanted to emphasize that most of these studies have really focused on cisgender women, and that there's really a paucity of data about transgender individuals. We know that trans women and trans men have an elevated burden of traditional risk factors, as well as unique social stressors compared to their cisgender counterparts. Additionally, there are unique risks related to transgender hormone therapy, this gender-affirming hormone therapy. And we really need much more data, including trials, to understand the safety about different formulations for these different therapies to help improve the cardiovascular health of this population and provide a culturally sensitive cardiovascular care.